Opinion: The Peptide Wild West. That's the headline from the New York Times guest essay by Julia Bellas. Bellas reminds us that one of the most successful activist campaigns in U.S. history was the push to keep dietary supplements virtually unregulated. In the early 1990s, Americans flooded Capitol Hill with letters and phone calls demanding the government stay out of their vitamin cabinets. The outcry, largely orchestrated by the vitamin industry, led Congress to pass a 1994 law that shielded supplement makers from the burden pharmaceutical companies face, proving safety and effectiveness through clinical trials before products reach patients. Since then, the supplement industry has ballooned to an estimated $70 billion, offering some evidence-backed products but also many dubious, sometimes dangerous ones, including metabolism, muscle, and brain boosters. Studies have linked supplements to thousands of emergency department visits each year and to a common cause of liver injury. Now, experimental peptides, short chains of amino acids that have not been proven safe or effective, could secure a similar shield by essentially bypassing full Food and Drug Administration review. This is part of a broader push to increase the number of drugs and ingredients that don't have to meet the strict evidence standards the FDA usually requires before they are marketed as improving health. Bellas notes the FDA was not designed for today's wellness-crazed era of telehealth, peptides sold online from China, and social media algorithms fueling demand. Yet the agency remains the only barrier between consumers and a Wild West market for these drugs. This week, an FDA advisory committee voted in favor of regulatory changes that would increase access to 6 peptides: BPC 157, TB 500, KPV, MOSI, CMAX, and Epidolon, even though none are FDA approved. The vote came after Health Secretary Robert F. Kennedy Jr.'s office named 8 new members to the committee, 6 of whom had ties to the peptide business. The committee's decisions are non-binding, but the FDA usually adopts its advice. If the agency follows through, compounding pharmacies that mix drugs tailored for individual patients will be allowed to legally make and sell these peptides. Bellas frames the meeting as a referendum on how to balance evolving consumer demand with scientific evidence. Americans want a health system that helps them live longer, healthier lives and addresses individual needs, and they are increasingly turning outside traditional care. The essay argues there must be a better way forward than dropping or circumventing the scientific standards meant to protect public health. Thanks for listening. I'm your host, signing off.